Dr. Nitya Raghu will be speaking on study of psychological variables in glaucoma patients affecting treatment compliance and disease progression. And Dr. Harsh Kumar will be the discussant for this. ओरिजिनली हमको मिला है एनीवे ठीक है तो आप कीजिए आपका लिख दीजिए डॉक्टर तनुज दादा विल बी शी इज फीलिंग स्केयर्ड नाउ
don't worry.
Yes, sir.
पहले वरी कर दिए उसके बाद डोंट वरी
Good evening, everyone. The reason for choosing this topic was to understand the psychological impact and adaptation of a patient to their disease, in this case, glaucoma. So we took up two psychological variables for the patients: coping mechanism and perceived social support. Coping can be divided broadly into two categories: problem-based and emotion-based coping. And most studies have shown that problem-based coping is more healthy and positive. Social support can be via friends, family, significant others. And according to studies done in other diseases like COPD and hypertension, patients who have a higher social support score do well emotionally, with a better emotional well-being, and are more adherent to a healthy lifestyle. In our study, we have taken patients who are known cases of glaucoma for at least 1 year, who are currently on anti-glaucoma medications, and had a previous year's documented visual field report with us. We asked them to fill out 3 questionnaires: the brief COPE questionnaire for coping mechanism, multidimensional scale for perceived social support, and Modesty medication adherence scale. The visual fields were checked at that visit, and they were followed up for 1 year to do a repeat field examination. A field test done 1 year prior to enrollment is also taken into account, so we got an adequate time to check for progression of disease. Progression of glaucoma was taken according to the AMGT trial as a minimum of 3 significantly progressing points in pattern standard deviation in minimum of 3 consecutive visual field examinations. In our results, we had 113 patients who were enrolled. 22% of them had a family history of glaucoma, and 34% had a glaucoma surgery done in the past. We divided them into 4 categories depending on the duration of disease. That's 1 to 2, 3 to 5 years, 6 to 8 years, and more than 8 years. The predominant coping mechanism among our MARC patients, 86.7%, had problem-oriented coping. However, patients who had a glaucoma surgery in the past and are still being maintained on medications had a higher score for emotion-oriented coping compared to the rest of our patients. And coming to social support system, the predominant social support was family in our patients, but patients who had a family history of glaucoma gave a higher mean score for friends as social support system. Further, adherence to medications, 38.1% of our patients had a high adherence, but 34.5% had a low adherence, which is very scary. But looking, a significant finding here was the 3 to 5 years category had the minimum adherence to their medications, and correspondingly, the maximum patients who progressed glaucoma had in the same category of 3 to 5 years post-diagnosis. So to understand these findings, we did discuss with our clinical psychologist, and the reason for having emotion-based coping high post-surgery, it could be that when given the option of surgery, they're initially hopeful that they won't have to use AGMs after this. When this doesn't happen, they adapt differently. Patients have a family history of glaucoma. It was said by Glenn F.C. et al. That though social support is a vital tool, patients have a feeling of anxiety and a sense of burden on the person they are depending on for help. So this could be a reason patients with family history are hesitant to rely on family who's already burdened with the disease. And coming to the duration of glaucoma affecting adherence and progression, this has not been researched in any other study till date, but it's possible that between 3 to 5 years, the initial anxiety of the disease starts waning off, that boredom and of taking the routine medications are setting in, and this could be the reason of the compliance dropping. After 6 years, it's possible that they have noticed visual field changes themselves, or it has been stressed upon by their physician, and then we see a gradual increase in compliance with the duration of disease. So limitations of our study, we did not have a glaucoma progression analysis available for us. We could have overestimated progression. And another significant one was we had to rely on the patient's honest replies in questionnaires, might not always have been reliable. In conclusion, though we did not find a direct correlation between coping mechanism and progression of glaucoma, we do say it is important to focus on psychological aspects of patient care to give a more holistic approach. And according to our study, red flag signs in glaucoma patients for both emotional and ophthalmic health are history of glaucoma surgery, living for the disease for 3 to 5 years, and those with the family history of glaucoma. Thank you. I'd like to thank my mentors, Meena ma'am and Kaushik sir, for helping me carry this out. Thank you.
Thank you, Nitya. It was wonderfully done. I wish I could speak like that.
Thank you, sir.
Just one or two things, especially if you send your paper. I am wondering that you have clubbed the psychological factors with disease progression.
Yes, sir.
Now the disease progression is maybe related to so many other factors,
Yes,
which
sir.
here you have not done.
True, sir.
So this really, especially when you send it for publication, please don't
Yes, sir.
add
That's
that on,
the-
because, and like you rightly yourself said, the limitation is adherence.
Yes.
That should have been a big thing. Either you should have given bottles to them and then called them back, or
Yes, sir.
something
We have to
like
rely
that.
on them honestly giving a reply whether they have put it or
But
not.
could you put it over there?
Yes, sir.
Excellent.
Thank you, sir.
1 minute, hold on.
No, I congratulate you. Very innovative topic. But two important factors you must take into account. One is the per capita income and the literacy of the patient.
Yes,
So
sir.
that has important bearing on the
Yeah,
adherence to
Bidun.
medication.
Yes, so socioeconomics, it is another important limitation we
Yeah.
have that was not taken into account for us. It's a limitation.
Well done, well done.
Thank
Well
you,
done.
sir. So, ma'am, we had three. One was for coping, a social support, and one was for. It is internationally used, ma'am, but we had to translate it to Kannada and Hindi. So we did that according to guidelines given by Sang et al. We had two people independently translate and then back translated by a third person. Thank you, ma'am.